Welcome. Welcome to the part 2 of our program where we talk about transforming elder care through coaching. And in our previous segment, we had a conversation with Coach Doreen Buff, who helped us understand what coaching is and how useful coaching can be in supporting senior citizens in their transitioning as they transition into a new season of life where things are different socially, financially, psychologically, etc. And so today with me, I have two amazing doctors. I have Dr. Ahlijah, I have Dr. Essel, and I'm going to ask them to introduce themselves, tell us a little bit about themselves, and then we can have a conversation where we delve deeper into geriatrics, actual care and wellness and health of senior citizens. You're both very welcome.
Thank you.
Wonderful. So, Dr. Essel, let's hear you, and then we'll go to Dr.
Okay. So my name is Dr. Kojo Essel. I work for Health Essentials, and our goal is to bring quality health care to your doorstep. I'm not a geriatrician, but I have a keen interest in making people enjoy their golden ages. And I hope that we'll continue to do that.
Okay. And I asked for two interesting facts about you connected to the elderly.
Yeah, so, my other cap is a wellness entrepreneur, which means I look for innovative ways to make health and wellness interesting. And, for years or for months, I've been trying to look at ways to help the elderly. And finally, in July, on my mother's birthday, I was able to sync a number of elderly people together. And instead of just eating, we actually had we had games, table games, we had massages, we had reflexology, we had some exercises. In fact, it was fun. And at the end of the day, they were dancing, they were happy. And just the social bonding, it made me very happy. I'm looking at doing this monthly going forward.
Fantastic, fantastic. Thank you. Yes, Dr. Ahlijah.
All right, so as you already know, my name is Lenusia Ahlijah. I'm a geriatrician. I work for the Ghana Health Service. I head Tema Polyclinic, which is now redesignated as Tema Urban Hospital. And I do some support work for Alzheimer's Ghana.
Fantastic.
And I love my older adult patients.
Fantastic.
And two interesting things about me with regards to the elderly. All right, so my parents are still alive. And interestingly, my mom is gradually getting into that space of forgetting that she's told me something. So many times in our conversations, I've had to tell her, Mommy, you've told me this already. And then the other thing is I have an older adult lady, she's 97, and she's able to call me with her WhatsApp phone.
Okay.
Yeah, and we have very good conversations. She actually takes time to call me when she hasn't seen me for a while. And she asks me, Doctor, would you come and visit me? Because she loves to spend time with me.
Lovely.
Fantastic. Fantastic. So one of the things that I'd like people to acknowledge is we have older adults, senior citizens all around us, whether they are at home, whether you see them in church, whether you see them in your place of work, etc. And so the conversations we're having are very relevant. And I remember someone once asked me, you're so young, why are you doing all this work with the elderly? And my response was, well, if God grants me the life, I want to live long and I want to live a healthy life. And if I want to get there and experience that, then let me start providing it. By the time I get there, the systems are built, our mindset has shifted, and we're doing things properly. Right? Very, very important. And today we want to shift our attention from understanding coaching to seeing how we can apply it, right? And let's start with communication. In our conversation with Coach Doreen, we talked about coaching really being about a very powerful, way of communicating. Let's talk about the status quo. How do we tend to communicate with senior citizens? Older adults, 70s, 80s, 90s. What is our default setting in terms of how we engage them? Let me start with you, Dr. Essel, and go to Dr. Ahlijah.
Right, default setting. A number of us, even the ones who are our parents, we tend to think that, they are slow, they won't remember some of the things. And from that angle, we tend to be a bit impatient. We also take it for granted that these are, people we've known all our lives, and that sometimes they are repeating things because they actually don't hear properly. So we tend to be over, what's the word? We tend to be too judgmental when it comes to when we are dealing with the elderly people. One, we think they're being slow. One, we think we don't take the fact that maybe they can't hear us properly. And then also, I think we are used to knowing these people who are fit, active, moving, and now when you have to even go somewhere with them, it takes forever for them to get ready. We are a bit too impatient, which is not a very good angle to come from.
Okay.
We also tend to want to tell them what to do, which is unfortunate, but if you are not careful, you actually get dragged into it, no matter how much you think you don't do that. You tend to want to tell them, oh, do this. But many of them are still sharp, and they still know what they want.
Yeah.
So I think we should be looking at giving them the opportunity to make their own choices. We should also be patient with them. You know, they cannot do things at the same pace that they were doing 10, 20 years ago.
All right,
You know.
Great, thank you. Dr. Ahlijah.
All right, so Dr. Essel has said quite a bit, and just to add to it, sometimes we get overprotective of them. I think that as much as possible, we should allow them to be autonomous and take a part in whatever decisions that have to be made concerning them. Not too long ago, I was in a conversation with one of my older adult patients and her daughter. A sister of my patient had passed, and they were planning the funeral and all that. And she happens to be one of the oldest people living now. And she felt that she needed to be at the funeral and probably a few days before then to give the younger one some counseling guidance as to how to go about preparing for the burial. But her daughter felt she was too old, she was too fragile, too frail to be able to do that. And I thought that it was, her interest and what she wanted to do was being overlooked. And, well, the daughter was coming from a good place. She was concerned about her mom's health and that she might fall and break a bone or something like that. But then she said, I think she's 87, but for my assessment as a geriatrician, this is someone who is aging successfully and could do the things that she wanted to do. She wasn't declining cognitively, and she had a lot to offer. So I had to come in and, just calm the situation and get my patient's daughter to understand that she needed to give her mom that space and that autonomy. So, yeah, sometimes we overprotect them.
And sometimes the communication is very patronizing.
Yes.
I have one senior who can't stand it when her caregivers are around her. Oh, grandma, did you why? Oh, grandma.
Yeah.
Oh, you can see she's seething inside.
It's actually very annoying, irritating. You can see them.
So the learning how to communicate, I think, is extremely important. Now, given how we tend to communicate, overprotective, we tend to be impatient with them. How does that affect them? Let's hear from you. How does that affect them?
Yes, it actually affects their self-esteem because they feel that they are being considered as incapable of taking care of themselves, and it's actually a way of taking away their independence. That's how they perceive it. They may not talk about it, but they feel it. And sometimes they play it back to us by being rebellious. Yes, they're like, I won't do this. And it's just because we haven't taken our time to hear them and understand that they need that autonomy to take decisions. Yeah.
Thank you very much. And your response points to one thing that seniors lose that sometimes we're not thoughtful about: independence. You know, where you lose your independence even when it comes to mobility, when it comes to decisions, etc. how important is that to a senior citizen? The ability to, take independent decisions. Is that something that is, well, not too important? They'd rather, depend on everybody around them to support them, or maybe that is important. I don't know.
I think there are two categories of elderly people. Those who prefer their independence, and a small group who want to be, when I say pampered, I don't know if pampered is the right word, but they want everything to be done for them. They will come into the consulting room, doctor, whatever you want to do, at home, oh, what are you going to eat? Whatever you are going to give me. Probably it's because they have been used to it over the years that people are now telling them what to do. But then there is the majority of people who want to be independent. I've had, I still have over 97, 96, 95-year-olds who want to go out. They want to come to the clinic, and when they come, they want the caregiver to sit outside so that they interact with you alone, which is not the best though. But I think losing your independence is a frightening thing. And I'm sure we all think about it even long before we hit our golden years. You want to be able to do things on your own. You want to be able to have a level of privacy. You understand? So when you start losing all that, and then you know that now I cannot move to even use a washroom till somebody comes for me, it can be a little distressing to majority of people. But then one of the things we have to know is that life has stages, and I'm sure this where Doreen and her team come in when it comes to coaching, so that we let people know that things are not going to be the same all along.
Okay.
Yeah.
Okay. Thank you. Yes, Lenusia.
Yes, so with regards to the loss of independence, I think that, yes, there are some who would appreciate the help, but then there are others who would want to do things by themselves. But then I think we need to see every older adult as different, because where they've come from would inform how they are and how they are handling the transition at the points that you interact with them as older adults. So it's important that we understand them in their context, and then do what we can to meet them halfway and ensure that they are as safe as possible and as healthy as possible. So we just need to provide that care on the individualized basis, knowing who we are dealing with. It's very important.
Okay.
Maybe I can let me just push this in when it comes to the independence, especially as they age and they try to be over independent. I think we have to make sure, like Dr. Ahlijah was mentioned, that their surroundings are safe. Because if it's not safe, then you may get into trouble. I mean, they may hurt themselves, they may injure themselves. So you have to be sure that the home is safe. And I keep telling people that there are some things that after 65, you shouldn't be doing. Your bathtubs, the kind of things,
bathtub.
you shouldn't even be bathing in a bathtub. Even when you think you are a very fit 65, it's about time to move into a shower, things that are safer. Get all those handlebars, keep your surroundings safe. Avoid, all these cables around. If you have grandchildren or children around the house, make sure they are not, because these are very dangerous. And you know how a fall to an elderly person is a major thing. I think geriatricians are scared of falls a lot. And then, and finally, most of the time, for you to be able to get all the kind of independence, the stability, we should, from now, be working on our balance. Most people would exercise, most people do all the other things, but one thing that we fail to do is how to include balance exercise or balance training in our routine. And I think it's extremely important.
Okay, interesting. So, in essence, we're saying that independence is very important to senior citizens. We shouldn't take it for granted. And this really has a way of tying everything that we do at age together in one word: dignity.
Yes.
When we started age, we had a number of core values, plenty, long list. But then as we engage seniors, we realize, look, it all comes down to one thing: dignity. Because whether they are at home or they go even into our health facilities, the indignities they suffer And some of the things are just, you know, if somebody has incontinence and they can't hold things together, that alone confers a lot of indignity, you know, to them, where now they have to stress. There are some senior citizens who don't want to go out. And it's because they know that it's going to take a while to get to the washroom if they need to pee. And once they get there, if they're not careful, they might, you know, embarrass themselves. So they would rather just stay home. And all that psychologically does a lot, you know, in the mind of a senior citizen, right? Yes. If we choose to look at this loss of independence as a challenge we want to address through coaching, where the decisions are not being made for seniors, but we're drawing them into the process so that they are part of decision making. How important is coaching as an approach, a conversation style, an engagement? How important is that to caregivers, family members? How important is it in the wellness of senior citizens? Let's hear both of you.
All right. Okay, so coaching is, what would I say, is a trump card. Most people have been doing some form of coaching, you know, one way or the other. It's just not professionally done, right? Because just giving instructions to that elderly person without letting them understand that you appreciate where they are, the state they are in life, and what they may be going through. Let them understand that you appreciate their feelings, and then work with them, you know, and then together find solutions. Look, if I have to go out, or if you have to go out, this is what we need to do. Maybe we have to eat at this time. And when we go, we would spend just a short time, especially initially. The benefits of going outdoors, the benefit of meeting people far outweighs staying at home all the time, you know. And when it comes to even the incontinence part, many people would not even love to use the adult diapers, but when you speak them, we talk them through it, they come to accept it. And I remember most of the time they come in and said, oh, my dad or my mom doesn't want to use it. But then when you start talking to them, I tell them, look, many people you see walking around are actually using it. And we are not saying that wear it all the time. If you have to be out, put it on. Still try to get to the bathroom, but then even if you don't, you will just have to. And exactly. I think it's all a matter of explaining things to them, letting them know that other people are going through similar things. They are not alone, and you are there to work with them. Once they know you are there and you take their opinion, they tend to work with you. They tend to work with you.
Right. Yes, Dr. Ahlijah.
Yes, and to add to that, maybe probably even with the issue of incontinence, there are other things, there are a few non-pharmacological things that you could do to start with. And there's something we call timed voiding. And that means that every 2 hours, whether you feel like using the bathroom or not, just go. And especially for those who have some level of control, because we have incontinence that comes in the form of urge incontinence. So they do have the urge, but then there are others who don't get the urge at all. So they will benefit from the use of the adult diapers. But then for those who do feel the urge, you can actually tell them about even where to sit when they go out to function. So if they are going to be going to church, which will probably last for 2 hours, you encourage them to empty their bladder before they go. And then when they go, you find a seat that is close enough to the bathroom. So you start telling them these things. So they still feel like they have some level of control. So having gone through that stage, when they get to the point where now it's like difficult, then they start appreciating the use of the diapers. So it's very important. And as much as possible, the caregivers also need to be brought into the conversation. And then with regards to the older adults as well, there's something we call ageism, where they come to the consulting room, you as a caregiver, we virtually overlook the patient, the older adult who is your patient, and you end up addressing the
caregiver.
caregiver, either a former caregiver or informal caregiver about some instructions. It's a no-no, because then the older adult is sitting there. It's like, okay, you're having a conversation over my head. I don't have a say in what you are doing, so I won't do it. But when they are brought into the conversation, little by little, they get to know what has to be done. They understand why certain things have to be done in the way that have been prescribed, and that really helps.
So talking about conversations, what are some of the ways in which we can have conversations that bring them into the picture? And it would be good to hear perhaps a couple of examples that you can share, ways in which we can draw them. And then we'll go back to the conversation on the role of coaching in all of this.
You want to go? Yeah.
You go first.
So, Doc, you are trying. Your question is, what kind of conversations do we?
Useful when we're having a conversation with an elderly person.
Yes.
How should we have conversations with them that bring them into the caregiving process, where we're not just here to give and do and say and instruct, but you're part of the process? How do we do that?
All right. So I think the main watchword here is that we are taking their opinions as well. So it's a two-way talk. So we have to plan, let's say, your hospital visits. It shouldn't be, I have time on Tuesday, that's when we are going. What time suits you as well? Oh, my schedule, it's also this way. But it should be a two-way thing. Okay. Then at a point, what we have to look at things like how busy is the place, because you don't want to go into a hospital surrounding and then have to sit there 3 hours, 4 hours, 5 with an elderly person. So we need to make sure that it's two-way. They have their opinions being heard, whilst you also let them know about yours, because otherwise sometimes they also take advantage and overdo it. So this is when I'm available. When are you also available? This is what will be convenient when it comes to the hospital, so that you don't spend too much time. So once the conversation is two-way and not just, sort of dumping it on them. I can go Tuesday, 8 a.m., be ready, okay. I'll pick you up, that is it. And then I think normally the caregivers may be, I don't know how you classify them, but some are hands-off caregivers and some are actually the hands-on. So the child may just come in when it's time to take them away. That is normally not a very good thing. Ideally, sit with the person and take those decisions. It shouldn't always be, I pick a phone, I call, caregiver, get the person ready. Let them feel loved. I mean, these are years when they should be happy, they should be excited, and trying to cut corners. Yes, people are busy, but when we try to cut corners, it doesn't bode well. And then, like Doc said, they start being rebellious because it's like, okay, I can't go. I don't want to go to hospital at all. I don't want to.
All right, great.
All right. Yes. So to add to that, we as caregivers, either professional or family informal caregivers, should also learn to appreciate the reality of your older adults. Because there are times when they may not be thinking the way you are thinking or reasoning the way you are reasoning. But if you tend to just brush up what they are thinking or what the opinions are, they feel like they don't matter, or what they want or their interests are not being considered. So it's important to actually get into their world and reason with them at that level. I remember a video I watched about an older lady who was living with her daughter somewhere in the States, and she said she was going to, I think let's just say New York State, and then she said she was going to Texas. And she went out. I think they made a mistake and left the garage door open, and she went out through the garage door. And then the daughter found her going, and then she caught up with her, and she told her daughter she was going to Texas with nothing, walking. So typically you'd say, "Oh, mommy, no, you don't have to do that. Let's get back inside." But this daughter calmly and respectfully told the mom, oh, Mom, you want to go to Texas? All right, I think you're going to be there for a number of days. So you probably would need to pack a bag. And then we need to go to the airport to get a flight. So why don't you go back in and pack a bag so we can plan to go to Texas? And that's how she was able to, and she complied. But then if she had gone at her, attacking her and reprimanding her, it would have been a different story. Okay. So it's important that as we deal and relate with our older adults, especially for those who probably have some level of cognitive decline, we need to be very calm, very patient, and get into their world and use what their reality is to help them stay safe and healthy.
Great. And just very briefly, if somebody is dealing with Alzheimer's or dementia, does this work? Do we presume that, oh, mentally they're gone, so what's the point? Or there's room for still trying to engage them in a conversation?
I believe there's still some room, depending on, it's a continuum. There are various stages. So depending on where they are, you could reason with them to some extent, but not just hit them with, a whole lot of information that they cannot process. So just little by little. So because Alzheimer's, for instance, or dementia is in about 7 stages. The first 3 stages are pre-cognitive decline stage. So they may forget their keys somewhere, that kind of thing. But they are still able to live some shows or live with some level of independence. But then for the moderate, which is like the stage 4 and 5, that's when it starts affecting their behavior, their personality starts changing. And even at that stage, you can still, have some conversation with them. But then there's the advanced stage or the severe form of dementia, which is the stage 6, 7, when it affects their physical function and their mobility. You may not be able to do much, but you still need to take care of them in terms of their feeding and, their personal care and all that. And you can still, have a way of communicating with them. They may not have the language to talk back to you, but then when you say something, they can hear and they can read facial expressions. Yeah, so you may pretend to be calm, but if the look on your face is like, Mom, then they will react. Yeah.
All right.
So.
All right. Yes. So so far we've talked about the importance of independence to the senior citizen and how we as caregivers need to make sure that they feel safe. We're not taking away their independence. And even where they need to be dependent on us for different reasons, we should use conversations and language that is patient, respectful, seek their opinion, bring them in, and not let them feel we're out there to, just issue instructions, etc. to them. It's fantastic. This has been really interesting in terms of delving into how we can use language, communication in caregiving. We're going to transition into a segment where we're going to bring our coach back and have a conversation really around independence and dignity. Dignity. As people grow older, it's very, very important. And at age, that's one of the things that drives everything we do. If it confers dignity, yes, we're all for it. If it doesn't, big question mark, and then we don't do it. And so let's take a break and then begin to get back into the conversation around coaching as a tool that can facilitate some of the things that we need to communicate to senior citizens and the information we need to get from them as well. Thank you so much. This has been a fantastic session. And we'll be back and we will continue with our coach back in the studio to have a conversation around how we use coaching to confer dignity onto senior citizens as we give care and support. Stay with us.
Thank you for watching session 2 of our coaching series. Don't forget to join us this Saturday for part 3, where we tie all the lessons we've learned together. It's going to be packed with valuable insights you won't want to miss. If you found this content helpful, please hit that like button and subscribe to Age Africa. Share this video with someone who might benefit from it. Drop your thoughts and questions in the comment section. We love hearing from you. Stay safe and coach with care.